Bed bath. Bed bath is a bath given to a patient on bed. The purposes of this procedure are the following: to remove transient microorganisms, body secretions and excretions, and dead skin cells, to stimulate circulation to the skin, to promote a sense of well-being, to produce relaxation and comfort, to prevent and eliminate unpleasant body odors. Special considerations: when you do bed bath to a client in bed, consider the following: avoid unnecessary exposure and chilling. Expose, wash, rinse and dry only a part of the body at one time. Avoid draft. Use correct temperature of water. Observe the patient's body closely for physical signs such as rashes, swelling, discoloration, sores, burns, abnormal discharges, body lice, etc. Give special attention to the following body areas: behind the ears, axilla, under the breast, umbilicus, pubic region, groin, and the spaces between the fingers and toes. Do not bath quickly but unhurriedly, and use even, smooth but firm strokes. Use adequate amount of water and change as frequently as necessary. If possible, do such procedure as vaginal douche, enema, shampoo, oral care, etc. before the bath. Preparation: determine the following: the purpose and type of bath the client needs, self-care ability of the client, any movement or positioning precautions specific to the client, other care the client may be receiving, client's comfort level with being bathed by someone else. Assessment: assess the following: assess the condition of the skin, fatigue, presence of pain and need for adjunctive measures before the bath, range of motion of the joints, any other aspect of health that may affect the client's bathing process. Assemble the equipment needed for the procedure. The equipment that we will be using are the following: basin and pitcher with warm water, soap in a soap dish, bath blanket, 2 bath towels, washcloth or face towel, a clean gown, additional towels if required, gloves, personal hygiene articles such as deodorant, talcum powder, alcohol, lotion, and laundry hamper. Procedure: explain to the client about the procedure to be done and how he or she can cooperate. Hi, good morning.
Morning.
My name is Malu. What is your name?
Mrs. Smith.
Okay, Mrs. Smith, I will give you a bed bath. I will clean your face, your arms, chest, and back, followed by the rest of your body. Will that be all right?
Okay.
Okay. Wash hands and observe other appropriate infection control procedure as needed. Wear gloves as needed. Provide the client privacy. Screen the bed if in the general ward. Prepare the client and the environment. Invite a family member or significant other to participate if desired. Close windows and doors to ensure the room at comfortable temperature. Offer the client a bedpan or urinal, or ask whether the client wishes to use the toilet or commode. Encourage the client to perform as much personal self-care as possible. During the bath, assess each area of the skin carefully. Prepare the bed and position the client appropriately. Position the bed at a comfortable working height. Lower side rail on the side close to you and assist the client to move near you. Loosen the top sheet and this may be replaced by a bath blanket. Place the blanket over the top sheet. Remove the top sheet from under the bath blanket by starting at client's shoulder and moving linen down towards client's feet. Ask the client to grasp and hold the top of the bath blanket while pulling linen to the foot of the bed and place it in the linen hamper. Remove client's gown while keeping the client covered with a bath blanket. Place gown, worn clothes in linen hamper or bin. Fill the basin with 1/2 to 2/3 full of comfortably warm water. Spread the bath towel across the client's chest. Make a bath mitt with a washcloth. Wet the washcloth or face towel and squeeze out excess water. Wrap the washcloth around the fingers to form a mitten. Wash the face. Wash the client's eye with water only and dry them well. Use a separate corner of the washcloth for each eye. Wipe from the inner to the outer canthus. Ask whether the client wants soap used on her face. Wash, rinse, and dry the client's face, ears, and neck. Wash the arms and hands. Place a towel lengthwise under the arm away from you. Soap, rinse, and dry the arm by elevating the client's arm and supporting the client's wrist and elbow. Use long, firm strokes. Pay particular attention to the axilla. Rinse the area 2 to 3 times, then pat it dry with a towel. Apply deodorant or powder if desired. Place the basin on the towel near the edge of the bed and wash the hands in water, paying special attention to the nails and spaces between the fingers. Do the same with the arm nearest you. Wash the chest and the abdomen. Place bath towel lengthwise over the chest and abdomen. Fold bath blanket down to the client's pubic area. Lift the bath towel off the chest and bath the chest and abdomen with your mitted hand, using long, firm strokes. Rinse and dry well. Give special attention to the area beneath the breast and the umbilicus. Change the water. Lower the bed and raise the side rails when refilling the basin to ensure safety of the client. Wash the legs and feet. Expose the leg farthest from you by folding the bath blanket towards the other leg, being careful to keep the perineum covered. Lift leg and place the bath towel lengthwise under the leg. Wash, rinse and dry the leg using long, smooth, firm strokes from the ankle to the knee to the thigh. Wash the feet by placing them in the basin of water, then dry each foot. Reverse the coverings and repeat for the other leg.
Okay.
Obtain fresh, warm bath water now or when necessary. Wash the back and then the perineum. Assist the client into a prone or side-lying position facing away from you. Place the bath towel lengthwise alongside the back and buttocks while keeping the client covered with the bath blanket as much as possible. Wash and dry the client's back, moving from the shoulders to the buttocks and upper thighs, paying attention to the gluteal folds. Use long, firm strokes. Remove the gloves and dispose it in a receptacle. Perform a back massage now or after completion of bath. Rub the back with alcohol or body lotion depending on the condition of the skin, followed by talcum powder. There are 3 main strokes used in back rub. Effleurage. These are smooth, long rhythmical movements that are used in moving the hands up the spine and then lightly down the sides. This technique is also called deep stroking. Pétrissage or kneading are large pinches of about 3 degrees of skin and muscles are taken, and the fingers move up the sides of the vertebral column and then over the entire back. Tapotement uses the edge of the hand in hacking motion over the surface of the back. Assist the client to the supine position and determine whether the client can wash the perineal area. If client is a female, finish with perineal flushing. If client is male, put equipment within reach and ask him to finish the bath. Wash his hands afterwards. Assist the client with grooming aids such as powder, lotion, or deodorant. Use powder sparingly. Release as little as possible into the atmosphere. Help the client put on a clean gown, clothes, or pajamas. Assist the client to care for hair, mouth, and nails. And make an occupied bed. Clean the area. Discard the used linen in the laundry hamper as well as the used bath towels and other materials. Leave the unit in order.
Okay, Mrs. Smith, we're done. How do you feel right now?
I'm relaxed and I feel comfortable. Thank you, Ma'am Malu.
You're welcome, Mrs. Smith.
Thank you.
Document the type of bath given, skin assessments such as excoriation, rashes, or skin breakdown, client's ability or cooperate and response to bathing, nursing intervention related to skin integrity.